Everybody, I'm Dr. Steve Karstensen, Chief Dental Editor of Dental Sleep Practice, a MedMark publication. Welcome to an educational discussion and Q&A with Dr. Ashley Spooner. In our webinar today, we'll discuss the collaborative nature of dental sleep medicine and strategies to improve patient outcomes and practice efficiency. Before we get started, I'd like to invite anyone to use the Q&A feature in the control panel to ask any questions. We'll be going through those questions at the end of the time. And now I'm pleased to introduce our speaker. Dr. Ashley Spooner has continually honed her skills through ongoing education, staying at the forefront of advancements in dental technology and patient care over the past 12 years. Her practice encompasses expertise in CEREC, CBCT, oral surgery, including implant placement, removable and aesthetic procedures, and comprehensive care for patients of all ages, integrating specialty services as needed. She's dedicated to preventive care and educating patients on the mouth-body connection. Dr. Spooner leverages advanced technologies such as CBCT and salivary diagnostics, digital radiographs, pharyngometry, and home sleep studies to enhance patient health and well-being. Through collaborative care with the medical community, she strives to improve overall patient health outcomes. Passionate about medical dental collaboration and improving patient health, Dr. Spooner founded Dynamic Dental Sleep. DDS serves as an educational and technological platform that trains dentists and their teams to screen for and treat sleep apnea within their practices. This initiative not only provides comprehensive education, but also offers seamless workflows in collaboration with industry-leading organizations, ensuring successful implementation into practices without disrupting daily operations. In addition to owning her practice and leading DDS, Dr. Spooner serves as a mentor, faculty member, and EPIC clinical champion for Pacific Dental Services. She passionately teaches team retention strategies, implant procedures, CEREC, EPIC workflows, and dental sleep medicine. She's responsible for collaborating with EPIC teams at Pacific Dental Services to optimize their EPIC electronic health record with AI integrations tailored for dental settings. This initiative aims to facilitate medical dental integration, empowering clinicians and the medical community with efficient workflows for comprehensive patient care to improve overall patient health outcomes. I can't wait to hear more about EPIC integration, Dr. Spooner. Thank you so much for joining us, everyone. Dr. Spooner, let's dive into today's topic.
Thank you. I appreciate it. I'm excited to be with you all today and to be able to talk how we can help to optimize your workflows and implement dental sleep medicine within your practice. So today we're here to talk about elevating dental sleep medicine within your practice. The key components of this are making sure that you're able to enhance team skills, streamline your operations, and then you'll be able to transform patient care. As we already introduced, I'm Dr. Ashley Spooner. I am passionate about training. Training is a key component to what we're doing within our practices, whether that is for dental sleep medicine or whatever that may be. This is something that I have taken on my forefront for the past 12 years and being able to help dentists, team members, and operations teams to be able to be the best in creating their efficiencies and their workflows within the office. So today what we're going to be focusing on is how can you expand team capabilities and have a team be on board with change and with implementing something new, like dental sleep medicine. We're also going to talk about how do you improve overall operation efficiencies and profitability. This includes optimizing practice operations, streamlining workflows, and reducing inefficiencies within the office. Lastly, we'll talk about how all of this will enhance patient experiences and outcomes, thus helping you to grow your practice, your profitability, and the purpose within what you do on a day-to-day basis. There's so many team learning opportunities. Today, we're going to be focusing on dental sleep medicine. As we do this, we're going to talk about the importance of dental sleep medicine overall and its role in enhancing patient care. We also want to talk about some of the common challenges and misconceptions associated with implementing dental sleep medicine into a practice. What strategies do we have to be able to help to integrate this as long as we have ongoing education and skill development? And then how do we do this to effectively engage and motivate our teams to learn about dental sleep medicine and to support us in implementing this into the practice? Now, I realize that some of you may already have training in dental sleep medicine, and you may have been doing this for a while already. As a piece of this puzzle, it's important that we're able to communicate the importance of screening for and treating sleep-related breathing disorders. The American Academy of Sleep Medicine currently estimates that approximately 22 million Americans suffer from obstructive sleep apnea alone. What we also know about this is that with the ongoing obesity epidemic, this is continuing to get bigger. It continues to show that obstructive sleep apnea is an 80% undiagnosed condition. Many people don't know what it is, and they don't know that they have it. What we do know about this, and as you heard in my introduction, there is a mouth-body connection. Untreated obstructive sleep apnea is linked to serious health conditions. This includes an increased risk for cardiovascular disease, hypertension, diabetes, stroke, and impaired cognitive function, such as early onset Alzheimer's or dementia. All of these are serious health conditions that just by simply screening and helping our patients get the care that they need with collaborative care with physicians, we can help. We can change this trajectory for our patients. Now it's important that we're able to utilize these statistics and to be able to help our teams understand why it's so important that we, as a dental team and dental providers, are screening for and treating this grossly underdiagnosed disease. So we know that obstructive sleep apnea, when treated, it can help a patient's quality of life immensely. Many patients come into my practice. They haven't slept. They're irritable. They're snoring. They can't sleep with their spouse because it bothers their spouse. They don't have enough energy to hang out with their kids at the end of the day. They're not performing well at work because they can't focus. All of these things affect day-to-day life, not to mention all of those medical conditions that we discussed. Just by treating obstructive sleep apnea, we can reduce overall medical costs for individuals by up to 50% a year. We know that untreated severe sleep apnea is fatal. It's just a matter of when. And even untreated mild to moderate obstructive sleep apnea reduces a patient's lifespan by 10 to 15 years. Again, all of these facts are simple to help to treat our patients, train our patients, educate our patients, as well as our teams as to why this is so important. The good news is this is a very treatable disease, and we have many treatment options to do so. Now, the American Academy of Sleep Medicine, as well as the American Dental Association, have both asked dentists to ensure that they are screening for sleep-related breathing disorders every patient, every exam. This is very, very important. Many times our physicians and our medical teams don't have the time to be able to assess all of these things in one short visit with their patients. We as dental providers are able to spend more time with our patients, and oftentimes we see them more often since most patients will come in at least twice a year. I always tell my patients, I look at down the hatch all day long. And so why wouldn't I be looking at airway? By just me evaluating a comprehensive medical history and also looking at the structures in a patient's mouth and comparing that with a CBCT, this gives me all the tools that I need to be able to assess if a patient could have a sleep-related breathing disorder. Next, then I can work collaboratively with my medical care teams to help to ensure that this patient gets screened, diagnosed, and treated appropriately based off of their condition. Again, these stances from the American Academy of Sleep Medicine and the American Dental Association it's very important that we help to follow these guidelines. They're asking us to help. This is well within the dental team's wheelhouse to be able to help patients. Now, I know oftentimes we providers, we go to a CE course over a weekend or we go to a conference and we get so excited about what new things we've learned. And we want to come into our offices and we want to tell our teams all these new things that we're going to start doing. I can see the eye rolls now. I've been there. Then the team's wondering, oh, how long is this going to stick? What's going to happen? The biggest thing with dental sleep medicine is there are misconceptions and there are challenges. Some of these challenges that we have is that there's insufficient training. Oftentimes what happens is you as the provider may go to this CE course, none of your team is with you, your management team isn't with you, and now you need to come back and you need to teach the entire team what all of this means. Especially if you've gone through the American Academy of Dental Sleep Medicine's Diplomate program. Now you have hundreds of hours of continuing education. How do you help your team to understand what you're trying to do and how you're going to do it? That's the hardest part. That's what I've spent the past 12 years figuring out. Number one challenge is making sure that your team is trained. We'll discuss how we can do this and some things you can be able to implement to help this to happen quickly. Reimbursement is also a challenge. Are you going to accept insurance? Are you going to be a participating provider with Medicare? Or are you going to have a cash fee? And then, of course, working with others. Dental and medical are very different worlds. And so how do we help to streamline those workflows to be able to collaborate with our medical teams and help to take care of our patients and make sure they don't fall through the cracks? All of these challenges are possible with a structured workflow. The misconceptions about oral appliance therapy, both by dentists and by the medical community, include that oral appliances are less effective than CPAP. Well, there is a study out there, efficacy versus effectiveness. And that shows that when you start to identify adherence, meaning that how long does a patient actually wear it, and what is this like in real life, both of these treatment modalities are pretty equal in their overall effectiveness. This means that while we know oral appliance therapy is best for patients with mild to moderate obstructive sleep apnea, those patients who do have severe obstructive sleep apnea but just cannot tolerate a CPAP, there's other options, and we can identify ways that we can help these patients. It doesn't have to be the textbook option. The other misconception is that this is not something that the dentist should be touching. This is just medical. Like I mentioned, we as dentists, we look down the hatch all day long. We look at airway all day long. We see sinuses. We see deviated septums. This is our wheelhouse. We can absolutely collaborate with our medical community to help to get these patients screened and treated. And the fact that oral appliances have limited use cases. Many patients can tolerate oral appliance therapy. And again, there's options to have co-therapy as well. So how do we start training and education once we've come back and then we've decided that dental sleep medicine is something that we'd like to implement within the practice? First off, I'd like to just let everybody know that just because you're doing dental sleep medicine does not mean that this is all you have to do. I love doing general dentistry. I love placing implants. I love surgery. So this is something that is a value add to my practice, but it's not distracting from my core business. Now that's taken time. And how you do this is you have to be able to train and educate both yourself and your team. The first step for this is you want to make sure that you're setting regular learning goals. You want to establish very specific, measurable learning objectives that are related to dental sleep medicine within your practice. And then start to track this. Set a timeline for yourself. This starts with you as a provider first, and then you can carry this on to the team. I feel in my practice that it's been great to incorporate online platforms for continued learning. It's always difficult to find time to be able to train a team and to get everybody together. Same if you have additional providers in your office, such as your hygienists or maybe other dentists. If you want to start to train them on how do we screen, it's time to be able to get something together to where you can do a webinar or a short online module to be able to get that process going. It's also important for yourself as the leader of dental sleep medicine in your practice to be able to find other ways to continue your learning. Whether you have extensive training in dental sleep medicine or you're still learning, there's always something new and the industry is always changing. Make sure you stay up to date on what those changes are. It's important to always incorporate something about learning and training within a team meeting. We always have breakout sessions within the team meeting. This could include breaking out between the front office and the back office, or doing this as the entire team, depending on the subject. For dental sleep medicine, you can start to now train on different skills. You can train on treatment planning for your front office. You can also share patient cases. You can talk about the wins that you've had and the lives that you've changed to help to continue to maintain that purpose as to why you're implementing something new within the practice. It's important that you are able to collaborate with your community medical providers. This is going to help with your continued referrals, but this is also going to be able to help you to communicate with these community providers and gain more trust within them in the treatment that you're providing. Sending letters, being able to call these providers, discuss patient cases, understand when a case is more complex. This will help that continued care for the patient. And set aside time to be able to go to different conferences and start to collaborate with more of your dental sleep medicine community. Empowering your team is crucial. What we know since 2021, of course, we had that thing called COVID. This really hit us hard. We now have 80% of hiring dentists that are having difficulty finding staffing. A piece of this puzzle and why we're seeing more turnover is there's such competitive wages. Our team members are not feeling as valued as they once did. They feel like there's no communication and there's a lack of training and direction. And they feel that they're just stuck in the same day to day. That they just do the same thing over and over again, and that their leaders and the dentists that they work with don't have a vision for the future. This is where focusing on that oral systemic link, incorporating dental sleep medicine, has a huge impact. And remember that the cost of turnover, when you're losing team members, now you're having to train again, you're putting burden on other team members, your patients start to notice the turnover and they start to question if they should maybe be switching practices, which can affect overall revenue. This is something that is very difficult. And in reality, what our team members want is they want to be a part of something that's bigger than them. They want to have purpose in their day to day. They want to feel valued, but they also want to know that they're learning. If we can do that and we can help our teams to learn more and to continue to progress and help patients day to day, this will help your team to be able to move forward and implement something new within the practice. Now, I know when you get back to the day-to-day of your daily practice, it's difficult to start to implement something new. Ultimately, now it's your decision of, is dental sleep medicine something that you're passionate about? and that you feel is a true value add for your practice. We've discussed all of the statistics, and I'm very passionate about it, so I hope that you are too. But it is truly something that you have to decide if this is a good thing for your practice. Is it possible? Absolutely. How you can start to do this and just start to discuss implementation with your leadership team is utilizing the RISE technique. What the RISE technique is a structured approach that is designed to help team members embrace change as a positive process. So what you start with is review. What are you currently doing in your practice? If you're already doing dental sleep medicine within your practice, what's working? If you haven't started yet, that's okay. How do you want to implement this? What's not working? Keep what's working, and then now it's time to decide we need to let go of what's not. The next step of this is what is in this for the team? You need to be able to identify this so you can communicate that with the team and also to yourself as you start to implement a new treatment modality within the practice. Once you've reviewed these things, the next step is to implement. As a part of the implementation process, this is where you're involving your leadership team. You need to be able to collaborate. You yourself, as the leader, will identify what you're going to do and how you want to do it. But now the implementation piece of the puzzle is, what are you going to change? Who is responsible for each portion of this change? Who are you truly doing this for? Is this for the practice? Is this for your patients, your team? Identify each aspect of that. When is this going to happen? You need to establish your standard procedures at this point in time. You must have structured workflows that you will follow every patient, every time. Whether that's the specific visits that the patient has, or as the provider, committing to screening every patient, every exam. These things need to be established as a part of the implementation process. This sets clear expectations and clear goals for yourself and for the team. Then schedule your rollout date. When do you, as we say in the Epic world, go live? From that day forward, you need to follow the implementation plan. Next, you move into the sustain phase. The sustain phase is important that the team is feeling supported. What we know is on average, you need to do something for at least 60 days for this to become a habit. This is for providers and team members. So start to sustain this new treatment modality and commit to your implementation protocols for a minimum of 60 days. During this time frame, you're communicating with your team, you're assessing what's working, what might not be working. And you're identifying what needs to be maybe refined as you start to evaluate. Just remember, for sustain 60 days, commit. You must be consistent and lead by example during this phase. After that sustain phase, you move towards evaluation. Here, you sit down, start with your leadership team. How is the process working? What are our wins? Maybe share some patient cases together. If there's something that's not working, how can we refine this? Remembering that implementing something new is always a dynamic process. Continue to speak positively about this to your team. Start to evaluate, Are there any changes that we need? And what are the benefits of a change if we're going to make it? After you've completed this evaluation phase, you may adjust your implementation protocols. Then you move back to sustain, and then you continue to evaluate. By continuing to follow this RISE technique, this is what's going to help you to establish streamlined workflows within your practice so that you can implement dental sleep medicine while not distracting from your daily business functions. As you are implementing the RISE technique, there are also 5 essentials to help dental teams overcome the fear of change. Many times we are afraid of stepping out of our comfort zone, whether that's in our life, whether that's in our jobs, whatever that may be. This is where it is a key to make sure that our teams have a trust in the leadership. We need to walk the walk. We need to commit to the plans that we set forth and hold ourselves accountable to that first. Then we can hold our teams accountable. We want to make sure that we have structured workflows and a structured plan so we can continue to provide clear and consistent direction for the team. We can't do one thing one day and then move and do it a different way the other day. We also want to be sure that we're transparent in communicating. Keep the team up to date on different things that might be happening, progress that you have, other things that you may be thinking about, whether that's a billing structure or adding a pharyngometer to the office, whatever that may be. You also want to ensure that you provide adequate time for your team to train. When I first started to implement dental sleep medicine in my practice and establish well-defined workflows, I did this myself first to identify that these workflows were consistent and that the patient experience was good. Once I identified the workflow that worked best and was the most efficient for the office, that's when I started to bring in my dental team members. I would train the dental team members on one step at a time. Just as you may have done in some of your continuing education courses, you practice. You might do a role play. You might practice hands-on. We need to provide our teams with that same security to do that before they're with their patients on the first day. When you can do this and allow them to master each step at a time, this is when they retain it, they do it well, and now they start to trust in the process of change. This also provides them with a realistic workload rather than throwing them all of the education that you've had over the years and expecting them to be able to process that and do well at it on a day-to-day basis. Ultimately, all along the way, as you're implementing this and utilizing the RISE technique, you want to make sure that you're open to addressing any obstacles, fears, or concerns from your team. Let them trust in you, that you're there for their development, and that you're going to help them overcome any of these things. Once you've been able to start to train your entire team, you will start to see that there are people that shine. This is when you identify who are your sleep champions. Especially as a general dentist who is still doing general dentistry, seeing general dentistry patients, and implementing dental sleep medicine into the practice, it is important to have a solid team around you. Once you've achieved this and you have well-trained team members, this is where you maximize on your efficiencies because your dental assistants can now be helping you screen for and deliver appliances and be aiding in the follow-ups while you're also still doing operative procedures. This is when you're helping more patients, you're growing your practice, and you've fully implemented dental sleep medicine into your general dentistry practice. Now that you have your team trained, you've utilized the RISE technique, and you're continuously checking in and adhering to the 5 essentials of a team member to overcome the fear of change, now we can talk about how we improve operational efficiencies and profitability. We all want to help our patients. We all want to help our teams. At the end of the day, we need to run a viable business. We're going to start out by talking about what economic throughput is and why this is important in our practices. How to implement strategies to optimize practice workflows and enhance operational efficiencies. How you can apply pricing strategies and navigate insurance considerations to maximize profitability. Identify co-therapy and referral for general dentistry opportunities. Develop approaches to balance financial goals with also providing affordable patient care. And then how to implement financial solutions and payment plans to improve patient access to dental sleep medicine. So the first step to understanding how to improve these efficiencies is to understand throughput. What economic throughput is, it's the rate at which a business converts its inputs, including time, materials, labor, into valuable outputs, which would be treatment, increased revenue, selling products, and increasing retention. But we also need to maximize efficiency and profitability. So how do we manage input? This would include, what are we buying for consumables? Are we wasting products? Are we maintaining our equipment? Also labor. Are we managing our team? Are we overstaffed? Are we understaffed? Are we in overtime? The output maximization is increasing your volume of services, such as, can you see more patients? Can you do more dentistry on the patients that are in your chair? What can you do to maximize the amount of revenue that you can get per chair hour? Then you include operational efficiency. How can you streamline every process that you have to reduce waste and to ultimately increase productivity? Ultimately, economic throughput is crucial for optimizing the efficiency and profitability of dental practice operations. By improving throughput, practices can increase revenue, enhance patient satisfaction, and manage costs effectively. So, when you start to increase and improve throughput, what happens? By doing this, you're increasing your revenue. This can lead to higher patient volume, more efficient use of patient time slots, and it will directly impact your bottom line. You also then have enhanced patient satisfaction. This helps overall practice growth and being able to attract more patients to your practice. Your patients are more satisfied because you're utilizing their time more efficiently. Maybe there's 2 crowns on a quadrant and you're doing them both at the same time and you're utilizing digital CEREC technology so they can have a crown same day. Maybe they also then, once they get those crowns done, they're ready for their impressions for their oral appliance. So you're tying that into the same appointment so they don't have to come back. This helps patients. Our patients are busy. They don't want to have to come back for multiple appointments. Also, managing your costs within the office. When you can do this and you can reduce waste and manage your labor, again, this goes straight to the bottom line. Now, the other piece of this puzzle is something that isn't as tangible. patient retention and team retention. When you're maximizing your throughput, your team is a well-oiled machine. They feel well-trained, they feel supported. This attitude then goes towards the patients, and the patients feel it. The patients feel the environment and the clinical culture that you have. They trust in your quality. They also trust in how you handle their finances and how you manage their time. Now you start to get more referrals. Your team also feels more purpose in what they're doing, especially with dental sleep medicine. They see the changes in the patients. They see how happy the patients are and how their lives and quality of life changes as you treat them. This increases retention. This also helps you as a provider to just feel very good about what you're doing and to have more purpose into your day-to-day. You're truly helping patients have a better overall health. That's something that all of us as providers would love to experience every day. So how do you do this? It's easy to say all of these things, but what do you do when you walk into your door tomorrow morning? What do you do to be able to implement this right away? Whether you're an experienced provider and you've owned a business for a long time or you're new at this, these are all things to continue to evaluate. First off, do you have quality scheduling templates? Is your team trained on what that looks like? Maximizing your appointment times, utilizing smart scheduling. What does that mean? Making sure that you have identified time slots for specific procedures. Yes, we need to be flexible. We need to have times open for emergency patients throughout our days. We need to be able to start treatment. But having time slots where your assistants have consistency, where your front office knows where to put a patient, and where you know you're going to have enough time to take care of them is extremely helpful. This also maximizes on what you can do while that patient is in the chair. This reduces downtime in the day, which also reduces process waste and labor waste time. Scheduling top down, as we all know, is an important thing to be able to do. But now you're also adding in sleep patients. Where do these sleep patients fit? When your team is trained and you can be prepping a crown while they're starting on your sleep patient, this is when you're maximizing profitability of chair time. This is how you start to implement dental sleep medicine within a practice without distracting from your daily core business. At this point, then you're helping your patients be treated, but you're also helping more patients at a time, maximizing that volume that we discussed. You also want to streamline your administrative processes. So whatever medical record system that you utilize, if you have the options of having online portal systems, fantastic. Get as much done before that patient is in the door as possible. If you don't have an online portal system, that's okay. Send the patient a welcome email. Give them homework. Make sure they've completed things before they get into the office. This ensures that you're reducing check-in and check-out times. It ensures that the patient is ready and understands the cost of their visit before they show up. You've been able to verify insurance, and you've also collected a comprehensive medical history prior to the appointment to provide your patient and your provider time to be able to fill out that information accurately. By doing this, you're going to maximize on the time the patient's in the chair and being able to treat the patient. And finally, make sure you have cost management. Are you setting budgets? Set a budget monthly and utilize the collections of your previous month. This helps you to hone in and to stay within the lines and your means of what you can afford. This also helps you to identify if there is process waste within the office and if that's a coaching opportunity for your team. Managing consumables and then understanding when you can also spend extra money on additional items that you'd like to have in the office is very helpful for consistent and streamlined revenue. All of these things are things that you can start tomorrow. Next, we want to make sure that we're optimizing operations. Speaking about dental sleep medicine, this goes back to, as we talked about, your implementation within the RISE technique. You need to ensure you have structured protocols. You need to develop a standardized protocol for patient visits to ensure that you're also providing comprehensive care, but you have an efficient use of time. Yourself and your team need to know exactly what's going on during that visit, what type of visit it is, and also what's next. Then you streamline your documentation. You should have structured templates for each visit. If this is an initial sleep screening, if this is a device delivery, if this is a follow-up, you should be documenting this the same way every single time. This helps you, it helps your team help you, and it helps you to teach other providers within your office as well. Ensure that you have effective referrals. Now, this means a referral from you to a sleep physician to help the patient get screened. What does that look like to help the patient have follow-through? How are you following up with that patient? This also includes then your multidisciplinary collaboration. We're working with medical care teams in order to have a collaborative approach with dental sleep medicine. This is when we know this is the most effective. Have you met with the physicians in your area? Do they understand what you need as far as a oral appliance prescription, the diagnostic sleep study? Help them to know what is useful for you to help to continue on this workflow, to help the patient to get through this process effectively and efficiently. The more that you can collaborate with your medical care teams, this helps the patient also have trust and maintain urgency of the treatment that they need. Then it's very important to be aware of options for care. If a patient is not sound dentally right now and they are not eligible for an oral appliance, are we talking with them about how we can help them? How can we help that patient get to that point? But during this time frame, can they use a CPAP? Can they use positional therapy? Can they use nose cones? There's many different options for care, and it's important to be able to provide all of those options and also to understand if there could be co-therapy between a couple of different options to help the patient adhere to treatment. When you can provide this and you can provide resources for that patient, whether you can do it within your office or it's somebody that you work with to help them, this is what helps these patients stick to it and continue to treat their condition. So what can you do right now? Whether you've been doing this for a long time or you're just getting started, make sure you have those protocols set. Do you need to refine those protocols at all? Do you have set resources for your team? And has your team been able to be trained on these protocols? Start to create outlines of what that looks like. Utilize other training materials that are available to you through other CE courses. Just make sure your team understands what the protocols are. Streamline your documentation. Make sure, number one, that it's standardized and that you're utilizing the same documentation for each different visit. Try to set templates for this so that you do not have to type this out every single time you see a patient. Make sure you have these effective referrals and that you're providing multidisciplinary care. The key to oral appliance therapy and to changing a patient's quality of life is to ensuring that we're including the medical team. When you do this, this is also going to grow your sleep practice because the medical community is going to see the successes that you're having and how your patients are so happy and doing well with treatment. This is what helps you to demonstrate how oral appliance therapy is effective. Always stay up to date on the options for care, whether that's new laser technology, whether that's Inspire or Remedy. Understanding what these different treatment types are so you can help be the quarterback for the patient help to answer their questions, but also help to provide them resources of where they can go if it's not something you do within your office. Again, all of these things can be established now, and having this solid structure is going to help you to continue to implement and grow your dental sleep medicine practice. Now, the next thing we need to consider is we've got structured protocols. Now you have your streamlined documentation, your team is trained, everything is ready to go. We've discussed we have to increase our economic throughput. Well, reimbursement is a challenge. The key to this is just understanding what are the reimbursements and what would you like to do within your practice. Here you can see average cash fee cost of oral appliance therapy. There's oral appliances alone, there's the follow-up visits, and then there's the total cost. If you're offering a cash fee, are you potentially going to bundle this with the follow-up so the patient pays one fee? You can do that. But also identifying that if you're going to be getting paid anywhere from $2,000 to $3,200 on an appliance and follow-ups, how are you maximizing your structure to ensure that your chair time does not exceed the compensation? This is where streamlined workflows are very important. It's very possible, whether you choose cash, whether you choose commercial insurance, whether you're with Medicare. But it's all about how you structure this within the office, utilizing the techniques we've discussed. So your cash fees, if you're including your follow-ups, anywhere from $2,000 to $3,200 on average, based off of data from 2022 and 2023. Commercial insurance, if you're looking at the appliance itself, then anywhere from $1,600 to $2,500. You start to add in those visits. Here you can see that there's a jump in your reimbursements. Now, not all allowed amounts are published and they're not always discussed. So it's hard to get data like this unless you're a in-network provider. So these are averages, and it's a best estimate that we can find at this point in time. Really, the most accurate data is to be in-network with the provider and be able to contact the provider. There are also different third-party medical billing resources that sometimes have different contracts with higher contracted rates. So that is definitely something that you can look into if you're interested in being in-network for medical, if you don't want to manage this on your own. When you start billing in network, there are verifications of benefits and prior authorizations that are necessary. It's important to be very familiar with this workflow to ensure that you are going to get reimbursed based off of your estimates. Patient out-of-pocket does vary based upon what their plan is, their copays, and their deductibles. These are all considerations to have. I know that's a lot of information. There are great resources out there to be able to help you to do this. And it is definitely something that team members can be trained on within the office. Again, it's just deciding for your office, what's the best way for you? Average Medicare ranges anywhere from $1,300 to about $2,000. This is something that you have to be a participating provider with Medicare to get reimbursed by Medicare. Dentists cannot directly bill Medicare for dental services or appliances unless they are covered under Medicare Part B as durable medical equipment. Medicare also generally does not cover the routine follow-ups. And so there may be an out-of-pocket cost for the patient for these. Again, you need to assess what your revenue is based on chair time and how to utilize this to help your patients with Medicare coverage. So with that information, what do you do? How do you have effective pricing strategies and accept insurance at the same time? I'm a PPO, HMO, and I accept Medicare for dental. And so that's something that we've decided to provide access to care for patients. That's a different model than being a fee for service. And so you have to decide for yourself, what is your model? What works for you? What works in your demographic for your patient flow and for your team? Ultimately, you want to consider that economic throughput to ensure that implementing dental sleep medicine in your practice is a value add and not something that's going to take away and distract from your daily revenue and your core business. With this, you also can start to identify co-therapy for comprehensive treatment plans. What I mean by this is, just as I mentioned before, there may be a patient that has periodontal disease that's active and untreated. They may have a couple of fractured teeth that are key components of your retention of your oral appliance. Start to communicate these things with your patients. Help the patients to get the treatment that they need so that then they can also treat their obstructive sleep apnea. There's also different therapies out there, including lasers. Can you use an oral appliance in combination with a laser for a more severe patient to help to achieve a better effective result? Can you use the oral appliance in combination with a CPAP to reduce pressure so now that patient is more adherent to care? All of these things can help to improve your outcomes, which also improves your patient's overall health. By doing this, this is how you continue to grow your sleep practice. This is also how you continue to grow your overall practice. Remember that by training your team, this is what's maximizing your efficiency and minimizing your personal chair time. Your team can help significantly in getting screenings done and completed for your patients. Dental sleep medicine is a lot of documentation of subjective and objective symptoms. Your dental assistants can be well trained in helping you do this. They can help scan. They can help deliver. You can be in multiple places at once when you have a well-trained team that's helping you move your patients within the process for dental sleep medicine. Utilize technology. Digital scanning. That reduces consumables of impression materials. It also speeds up your processing time of your lab because it gets to the lab immediately. You can start to identify if there's anything with the scan that needs to be adjusted, rather than waiting for those impressions to reach the lab only to find out you have to get that patient back and do another impression. Utilize patient portals or email systems, whatever you have access to make sure that you're gathering all the information possible to keep patients moving throughout the process. This is especially key if you're accepting insurance and billing medical. By being able to obtain VOBs and prior authorizations and communicating with a patient via a portal or an email, that helps to move this process along so this isn't drug out for months and months. Also, by digitizing claims, this helps you to process claims faster, which is a benefit to the patient, as well as it helps you to get paid faster, which will also help to make sure that you have a consistent revenue stream when you're delivering oral appliances. Then make sure you're partnering with labs. It is very important to understand if a lab has an FDA-approved device, what their turnaround time is, what is the presentation of the device when it comes in, and also what's the quality of it? How easy is it to deliver? Are you making a lot of adjustments even though your scans or your impressions are accurate? What does that look like? The quality of an oral appliance drastically reduces your chair time. You should be able to deliver an oral appliance within 30 minutes. If you're having to adjust and do all of these other things, well, now you're eating into that chair time revenue that we just discussed. Your efficiencies are going down. So having quality labs with appliances that you're well trained in and you know are going to fit from the minute the patient gets it is extremely important. And also having a good turnaround time so you maintain that consistent stream and workflow both for your patient and for having your revenue stream upon delivery. So now that's your choice. What is your practice model for sleep medicine? Just as we all have different practice models of fee for service or accepting PPO only or PPO and HMO within our general dentistry practices, this is the same thing for dental sleep medicine. As you're starting to consider what you would like to accept as far as insurance or cash fees, you need to understand what physician referrals do you have? What's your demographic like? What patient volume do you have coming in? And then are you able to offer payment plans? The key to oral appliance therapy is patients do want to help themselves, but cost can be an issue. How are we able as providers and as businesses to get creative and to help these patients get the treatment they need now, but also being able to afford it, whether that's spreading out payments or having different options to be able to get the therapy that they need? The more that we can be flexible and have great solutions and options for our patients, this is what's going to help them get treatment started. And once they start and they feel better, they will continue and they will continue to refer patients. So we've talked a lot about the business side and how we train our teams, how we ensure that we can establish and implement something within our office that is change and that can be scary. The real winner in this and the excitement that we have is that you're truly offering a life-changing treatment with dental sleep medicine. So how do we do this? We know that this treatment is life-changing, but we need to be able to communicate this impact to our patients. We also need to be able to show them what is this benefit and compare this for our own knowledge to other general dentistry treatments that we do. And how do you customize treatment plans to provide ongoing support? This ensures you have a patient-centric approach and that you're improving overall patient satisfaction. So research shows that we definitely have a quality of life improvement for many of the treatments that we offer as dentists. When we start to compare this, oral appliance therapy, we know that this helps patients to achieve a higher quality of life by improving their sleep. They're not as tired throughout the day. They have a better mood. Their relationships are better. They may be performing better in sports or at work. All great things. By treating periodontal disease, we're reducing pain and discomfort. We might be reducing bad breath, which could cause embarrassment in a social situation. And we're improving overall function. If we do a full mouth rehab, we're definitely enhancing function and we're enhancing self-esteem. Now for our health impacts. The oral systemic link is huge. Oral appliance therapy, we know this reduces risk of heart attack and stroke, cardiovascular disease. It improves overall systemic health. It helps glycemic control. It can aid in weight loss. So many benefits. As we mentioned, it reduces annual health costs by 50% over those who are untreated. Periodontal disease, there's so much data out there as far as treating periodontal disease, reducing chronic inflammation. This improves overall systemic health, better glycemic control, better heart health, reduced risk of early onset Alzheimer's. It also prevents miscarriages. So much information on the mouth-body connection oral systemic link. Full mouth rehab, again, better overall health, but really not a whole lot as far as systemically. Maybe some for digestion if chewing function was really changed over time. This is important for us to realize of all of these things that we do and how we truly impact patients more than just fixing a tooth. And this is what we see with oral appliance therapy is I can tell you, I get goosebumps when I see my patients come in and they're thanking me for giving them their life back. Their spouses are coming in and thanking me that they can sleep again. They are different people in the office. They go from a grouchy, disengaged person to somebody who's jovial and excited and just happy to be there. And then we start to see the systemic effects as well. It is a truly rewarding treatment to provide for our patients. What would you say overall just now of if you think back to before you had the appliance to now maybe you forget to wear it for a night or something like that, what are the differences that you're noticing?
If I forget to wear it, I can definitely tell the next day. I told Dr. Spooner after I wore it for the very first night, I felt like I hadn't slept that well in years. It was completely different feeling, waking up and feeling completely rested. And that, I was getting good quality sleep and, feels like maybe you were wasting your time sleeping before, and now it's really great. And I wake up in the morning feeling ready to go for my day. So it's been wonderful.
It's great to hear that. If you were to tell anybody who's looking into this or who may just not be feeling great, what would you tell them about what they should do?
I tell people all the time that they should look into an oral appliance. It's honestly one of the best things I've done. I feel so much better. I work much more efficiently. I don't ever get that like 2 o'clock tired feeling that everybody talks about anymore. And I just am able to really thrive throughout my day, I think. And so anybody who struggles with sleep and struggles with sleep apnea, that they don't want to wear a CPAP, which I think a lot of my friends that maybe do, when I'm 31 years old, so nobody really wants to be wearing a CPAP when they go to bed. And so the sleep appliance is just so easy. It's so easy to travel with. It really just adds to my life, and it doesn't require me to think about it at all. It's wonderful.
And that very first night that I wore it, the next day when I woke up, I can't describe to you how bad my sleep apnea was affecting my life until the very first time that I used the device. I could tell I got immediate relief. I was suffering from headaches and sleepiness during the day and all kinds of exhaustion that I couldn't pinpoint what was wrong until my sleep apnea diagnosis and then use of this device. The other thing that's important to understand is that I couldn't use a CPAP machine. It was prohibitive with me for traveling, and I just couldn't bring myself to use a CPAP machine. So I use this as an alternative, and it treats my condition as well as provides something easy for my lifestyle.
And then Denise, what would you tell other people like you who are considering a sleep screening or have sleep apnea but aren't treating it?
I think that it's important that you recognize you have a condition that can be life-threatening. It also affects your whole life, not just your health, but just your interactions with other people, how you feel, how your energy level. If you're not treating your condition, I highly recommend that you reconsider that. This is a simple remedy, and it's easy to adapt to your life. It's non-intrusive, and it will change the way that you look at everything. Just the way that you feel about life, how you feel about yourself, and just your ability to live a quality life.
So you can see there from just some very close patients of really what this transformative effect is for patients. I love having testimonials like this. And like I said, these are the patients that give me goosebumps when I hear these stories. This was all them of saying how this helps them. I provide this for you so that if you don't have those stories yet, use these. Use stories that you've heard, because this is what helps you to communicate these benefits to your patients. When you can personalize the communications for these patients, this really helps to engage the patient and tailors the message to them. It helps it to make it more relevant so that they understand how this is affecting their life. Instead of saying, this oral appliance will improve your AHI, let them know that this is going to help you breathe better while you sleep, and you're going to feel more rested during the day. Your headaches are going to go away. That's way more engaging and impactful for a patient. Utilize visual aids. If you have oral appliances that you have on models in your office, fantastic. If you have a poster that shows the airway, if you have been able to take a CBCT and you can demonstrate the constricted airway and talk about what that means, all of these things help to engage the patient. Just make it simple. I always tell people don't need to know the big words that I know. As long as I can help the patient to be engaged and understand why this is important for them, that's really what's going to help them. Highlight the benefits for that specific patient. Emphasize on how this is going to improve their quality of life. This is where your comprehensive medical history comes in. Tie it together with what they're experiencing. Tie it together with their family history. When you can do this and help them see that they could have a changed trajectory, that's impactful for them. Utilize evidence-based information. Have information, have testimonials, just like I showed you. Have stats. Patients want to know that this is truly something that exists out there and that you just didn't go to some course one weekend and decide, oh, this is another way I can make money. Because that's what patients sometimes think. The more that we can truly show how much we believe in this and how important this is and what true outcomes we have, patients are going to see that. They're going to see that through you as the provider, and they'll see that through the team as well. Make sure that your patient feels comfortable asking you questions. Let them express any concerns that they have. And provide very clear and straightforward answers and information that they can take home with them. Ask your patients, do you have any questions about how this could work? Or any concerns about what I'm talking about right now? And then ultimately, you want to make sure you have a supportive environment. Build trust with your patient. If they're not ready to hear all of this right now, ask them if you can follow up with them. Ask them if you can send a letter to their physician. Let them to digest the information you've provided, but also make sure that you continue to follow up. Let your patient know you're here to support them throughout the process, and that you will be checking in on them because this is something that you want to make sure that you can help them. Patients receive this information much better when we take these approaches. Now, when you've mastered all of this and you can start to communicate all these benefits, this goes with your dental team as well. Your team starts to see these enhanced patient outcomes. They see these patients coming in and how you've changed their lives. You do this together as a team. This is what keeps them engaged. This is what helps them to see that you didn't just go to some CE course and you want to add something that's going to add money. This no longer becomes a thing that people feel they have to sell. This is truly a part of your clinical culture of screening and treating obstructive sleep apnea, helping your community to be healthier overall. This gives you a deeper connection, and your team has a deeper connection with each other, but also with their work. It provides a true sense of purpose. This also develops those skills. As we talked about when we first started, our team members really just want to feel a part of something big. They want to feel that they're developing and they're continuing to get better. This does that, and it opens a slew of opportunities for our team members. You're going to have practice growth, not only in your GP practice, but also in your sleep practice. This is where this becomes a value add, and it's not distracting from your daily business. If anything, this is the cherry on the sundae in addition to the operative treatments that you're doing. Not only do you get to help patients be healthier, but also you're adding revenue to your practice. And it's fun. And you gain such rapport with your medical community. I love the referrals from my physicians because these physicians trust in what I do and they tell the patients that. These patients walk in the door ready to do anything that we discuss because the physician has already created that trust in me. Then I can help to collaborate with the physician so we can see the overall outcome. This multidisciplinary care model is something that has helped my practice grow immensely in the past 5 years. You can do that too. So studies show when we apply these techniques of really engaging our patients in any treatment that we're recommending, that adherence improves. When we provide individualized care and shared decision-making, this significantly improves adherence to treatment. When we also then continuously follow up and make sure that our patients are doing well with the therapies, this improves up to 40% of adherence. And just by communicating with the care teams and having everybody on the same page helps our patients to continue to follow through. Our patients then trust us more and they overall just have a better experience. And as they're having a better experience, that alone helps them to follow through with treatment. So just continue with a patient-centric approach in order to continue to increase adherence, which also increases your retention. Well, we've discussed a lot today. Now you have key takeaways that you can implement starting tomorrow. First off, you know how much this is needed. We know that this is an 80% undiagnosed condition, and the dentist can screen and treat. We need to work together with our medical care teams and collaborate to help get the diagnosis. The ADA and the AASM have asked us to do this as providers. This is something that you can absolutely integrate into your general practice. It requires structured workflows and utilizing the RISE technique to help your team to support you. But with continued sustainable training and having dynamic evaluation to make sure that you're establishing streamlined workflows that are efficient for your office, you can absolutely implement dental sleep medicine into a general dentistry practice. Make sure that you're setting forth your operational efficiencies and profitability. Maximize your inputs, your outputs, and your efficiencies. When you can do this, then you're going to enhance your throughput and increase your overall revenue. This is going to have such a transformative impact, not only on you as a provider, but also your team and your patients. Be confident in that impact. Communicate that impact. Help your team see it. Help your patients see it. This is what's going to help continued growth of your dental sleep medicine practice. Make sure you have streamlined workflows. There are many resources out there for you to help you to establish this. Utilize those resources. Utilize others who have established it ahead of you, and then adapt it to your practice. This is going to help you start tomorrow. What can you do now? Refine your approach. Whether you've been doing this for a while or you're starting to implement now, decide what your clinical culture around dental sleep medicine is. Either review and update or start to establish what are your dental sleep medicine protocols within the office. Start your RISE technique. Implement your approach. Create your outline. follow it for a minimum of 60 days before you reevaluate. Make sure you have consistent training, and as your team gets more advanced in this, that you have advanced training. Your team wants to continue to learn. Continue to streamline operations. Make sure you're continuing to refine, and then you implement and then optimize. And expand your patient outreach. How are you discussing dental sleep medicine and screening with patients? Are you engaging the patient and providing them with options? Do you have a patient-centric approach? Start to collaborate with the physicians in your community. Create relationships. Send letters. The more you can communicate with them, the more you will have continued evaluations, referrals, and adherence from your patients. Thank you so much for joining me today. If you would like to have a handout of what we've discussed today with key bullet points and takeaways for you to implement into your practice, please visit dynamicdentalsleep.com and visit our contact page. Send us a note and we'd be happy to send you the handout. I'd be happy to answer any questions.
Ashley, thank you so much. Man, I can picture people watching this over and over and over again because of the detail that you shared with us about taking a practice and adding exciting service and interesting new professional growth to that practice in ways that make a lot of sense and maximize the throughput. I like that phrasing that you use there. So you mentioned a couple of times how a dentist would come back from taking like a weekend course, but then the gist of your presentation shares that it takes more than that. So walk us through a little bit maybe about how a dentist who's fairly new at this could learn what they need to learn and then start to formulate this plan for implementation.
Absolutely. So one thing that I always recommend is as you're learning something like this, it's okay to be honest with your patients. And so first step is start to build a queue of patients that you feel comfortable telling them, I'm learning something new. I think you would be a good candidate for this. Would you be open to being one of my patients as we start to implement this? This really helps to remove that pressure of, oh no, this patient's paying me a lot of money for this and I have to do this perfectly. And what if we mess up a little bit? What if there are hiccups? You can offer this patient a discount off of this treatment, whatever you feel is good for the patient to be able to do that. But that is something that helps a lot to get started. As you do this now, this helps you to then identify, okay, what is this process I'm going to take this patient through? And then you can talk with your team of what that looks like. First off, when you first start to establish what this workflow is for you. Take extra time. These visits will take extra time when you first start, but then you will start on the efficiency side of it. So if your first initial sleep visit takes you 2 hours because you want to make sure you get through everything and you touch it and you're training your team as you're doing it, that's okay. The idea behind spending that time initially is that you're identifying what's working, and then you're able to streamline it and cut that down from there.
And then you mentioned that you run that protocol for a couple of months.
Mm-hmm.
And then do you refine during that time, or do you like take notes and then refine all at once at the end of minimum 60 days you mentioned?
With the team, yes. So a team, you don't want to be continuously changing unless there's something drastic that absolutely needs to be changed right this second. But if you're, as the provider and the leader, just noticing some things you want to maybe fine tune, gather that together over that 2-month time frame. Then from there, you meet with your team. Start off first with the leadership team and whoever you've identified are your sleep champions. Talk about what you've seen. Let them provide input as well. Then decide what are these few refinements we're going to do, and we're going to do this for the next 60 days. If you start changing too many things all at once and too quickly, then you really don't know if it was just a kink in the system, or if there was just more experience and training that was needed. You don't want to jump the gun too quickly.
Do you do you recommend using third-party billers or do it all in-house, or how do you have a dental office do medical billing?
Absolutely. So I really think that that is per office. And so it depends on what's the scope that you have up front. Do you have enough manpower to be able to do that? It does take time. It also takes time to get in network. And so advice that I have, if you want to do this on your own, identify what are the most common commercial payers within your area. And then you can start to see what are those allowed amounts. You're not going to be able to get in network with everyone. And so identifying who that may be. For myself, it's Blue Cross Blue Shield and Cigna. And they're the most common people that we see. And they were accepting dentists to be in network with medical, which is also a difficult thing. What I can say is that process took me about 8 months to do. And so I didn't want that to inhibit me from being able to get started. And so having different ways to do this is important. The benefit of these third-party billers is that, yes, you do pay more in a billing fee, but they truly do handle everything for you. And so that's something that if you do have increased volume and you can provide more in-network contracts and you can support that, then maybe that's a good thing for you. That's really, you have to just decide what's best for you. The third-party billers also, once you start and you contract with them, from day one, you get to start going. You don't have to wait and get credentialed and do all of these other things. So again, I don't think that one way is bad or one way is good. I think it's really just a preference and what's best for your office and your revenue stream.
So there's a question about DSOs. They say they work for a DSO. How much power do you think they don't feel like they have much power to implement this? So what would you suggest for a dentist who's excited that has, works for an organization like that?
Absolutely. So I'm a partner dentist with Pacific Dental Services. And so this is something that this has been my passion project for sure, to help dentists within an organization like this to be able to implement it. It is a little bit more difficult just as far as helping to make sure the organization has a set plan. That is something that I, within Dynamic Dental Sleep, help to do as well. And so that's somewhat where this all came from. Training is key, and then just identifying the workflows within that DSO system. And there's many ways to skin a cat, so it's definitely possible. And by any means, it should not stop us as providers from at least screening patients and helping patients to get diagnosed. Whether you're deciding if you want to treat with oral appliance therapy or if you really aren't interested in doing that piece of the puzzle, that's okay. Just make sure we're helping the patients.
So to that end, then I noticed when Denise was doing her testimony that there was the banner covered a little bit, but you had a CPAP there. So do you talk about two things, I guess, combination therapy, you did mention that, and then also follow-up testing. That's a big thing that a lot of dentists are curious about.
Absolutely. Follow-up testing is so important. You absolutely should have an efficacy studies that has been interpreted by a sleep physician. We want to work in collaboration with our medical teams. As the dentist, we provide the appliance, but we need to ensure that this is truly treating their condition. And we're not necessarily trained in all of the impacts that could have. So very important that we have those efficacy studies and that we're working with the patient's medical team to ensure that they're treated effectively. As far as combination therapy, this is something that absolutely works. I have many patients who have been intolerant on CPAP alone, but that's because they have severe sleep apnea and they've got a jet engine going into their face all night long. When we're able to utilize an oral appliance and help to move the lower jaw forward, well, now we can reduce pressures. Now it makes that CPAP more tolerable. Now we are thoroughly treating that patient's severe sleep apnea.
So do you dispense the CPAPs, or is that another thing you do in conjunction with the medical colleagues? How do you get a patient who maybe, let's talk about it the other way. You give them an oral appliance, they're not quite, good enough. And so you think, well, maybe a CPAP's the right idea to add to this. Do you make that decision, or does that go back to the sleep doctor? How does that flow for you?
After every patient visit that I have, I always send a letter with a summary of what we've done for the patient and also any titration or efficacy sleep study data that I have. From there, I am asking that medical provider for their expertise, and I let them know what I see. I will indicate I think this patient could benefit from oral appliance and PAP therapy or possibly supplemental oxygen. And then I ask them to evaluate and then have an evaluation with the patient. I also notify my patient that in the office, I'm going to send a letter to your physician. I want you to call your physician's office. This is what I see. This is what I would like for you to discuss with them. So engaging that patient is extremely important, that they have some ownership over their treatment as well, but that they understand that we're working together to try to help them have something that they can adhere to long term, but also feel better.
So this isn't really a question. I just like to magnify something that you've been presenting all during this entire time, is that your team gets to run a lot of this for you in your practice. So you can be in one room prepping a crown. Somebody else can be starting your sleep patient, like you mentioned. But it also takes a lot of doctor engagement on a management basis. How do you think your way through this and make doctor level decisions without necessarily being as hands-on with the actual appliance? So that's something that is a different level for us to be as dentists, isn't it?
It is, absolutely. And I think this is where that streamlined documentation is key. So how my team helps me, and I'm fortunate I get to work with an Epic and I got to build all of this with an Epic. But how this works there is that my documentation is the same every time. My team has very set standard questions they fill out with the patient in the chair every time. So even though I may not be in the room for that portion, I can very quickly review that documentation and I can compare it from their initial visit to now a follow-up or whatever that may be. And I know that story right away. Once you've been doing this a while, you can pick up on those things quickly and you can move forward very quickly.
Well, Dr. Spooner, that is all the time we have for today. I want to just thank you for how great this has been, so detailed. And like I started off saying, I can picture a very interested office and team watching through this over and over again, picking up on the references you put in there, walking through the steps. And so I really appreciate this, but we're out of time. I want to really thank Panthera Dental. You know, I try and be neutral about appliances out there, but I got to say that I think Panthera and the company, I know they've supported many of these webinars for the magazine, but they do that because it's part of their culture of being a really high quality device manufacturer and high quality company as a general. And everybody I've met's a high quality person. So I guess I could say I'm a fan. But anyway, thank you, Dr. Spooner. Thank you for the all this time and energy you put into putting this together. It's just a glimpse into the energy you put into putting your practice together. And I think that forms a good model for many of us out here to really make a difference in our community health by being excellent doctors, not just dental oral doctors, but whole person doctors like you are. So thank you that. Thank you again for Panthera Dental and for MedMark Media for putting this together. And I hope all of you will be able to be super effective clinicians for your community health.